action.
Okay, so here we got the brain. This is going to be the frontal portion. This will be the caudal portion. Of course, this is superior. We got the two cerebral hemispheres, right and left, and there's a separation here called the longitudinal fissure, okay? We have this part here, the transverse fissure, and that is also called the Sylvian fissure. It separates the temporal lobe over here with the other ones, which I'll mention in a moment, okay? This is going to be your cerebellum, and the brain stem is over here, and I'll show you when we do the sagittal cut. You will see all the crevices around here. These are sulci. Many sulci are one sulcus. The bulges over here is one gyrus or many gyri, okay? We have one particular sulcus that we should all know and love. This one that goes here, and it's really the only one that goes from the longitudinal fissure downwards in a one long sulcus. This is going to be the central sulcus. This will separate the frontal lobe with the parietal lobe. Back here will be the occipital lobe. It's hard to say where the delineation is between the parietal and the occipital, but this would be the occipital over here, parietal here up until the central sulcus, and then this is all frontal. So when we go back to this central sulcus here, the gyrus that's found more rostral is going to be the precentral gyrus. The one that's going to be here that is going towards the caudal part of the brain is going to be the postcentral gyrus. The postcentral gyrus is going to be in the parietal lobe. The precentral gyrus is going to be in the frontal lobe. The precentral gyrus is going to be primary motor, where nerves are going to leave here and descend into the spinal cord. The postcentral gyrus is going to be receiving all the ascending fibers from the spinal cord, and this is going to be the primary sensory. Okay, let's talk about the inferior portion. Just to get you oriented, these are going to be your temporal lobes. This is going to be your frontal lobe. And here's your cerebellum, the two heads of those hemispheres. We will see over here, and I gotta get closer here. You will see a number of things here. This is going to be this whole thing is the brainstem. The parts of the brainstem, this portion here is the medulla oblongata. This is going to be the pons, and not quite being able to see it well is going to be the midbrain over here. So we got midbrain, pons, and that is going to be the medulla oblongata. If this is in the skull, you'll also see that the foramen magnum of the occipital bone will be around here, and that's going to divide the medulla oblongata with the spinal cord. That's where the spinal cord begins, okay? A few things up here. This is going to be cranial nerve number 1, and this is going to be the olfactory, which deals with smell. There's a few parts on here. This is going to be the olfactory tract, and when it flares out up here, we call that the olfactory bulb. And we got another one on that side too. You will also see this portion here. Well, this shows an X. This is good. So there's an X here, if you could see that. This is going to be dealing with the optic nerve, because these two up here is going to be the optic nerves, and they go to the eyeballs. Back here, before they cross over, is going to be the optic tracts. Where they crossed over is going to be called the optic chiasm. You will also see rostral to the optic chiasm, these two bumps. That's the mammillary bodies, deals with memory. And that's pretty much what you need to know, at least for me, on this. However, let's look a little bit more to the sheep brain. So you can appreciate that. So just to get you oriented, this is going to be rostral. This is going to be more caudal. You will see that there is the two cerebral hemispheres. This is the superior portion. This is going to be the longitudinal fissure. It's difficult to see where the central sulcus is, let alone the pre and post central gyri. So I wouldn't ask on here. But we could say that this area over here is going to be the frontal lobes. This middle area will be the parietal lobes, and back here will be the occipital lobes. The temporal lobe, you can see, it's this part over here. You could also see it on this side too. Okay. You could also appreciate that this will be the cerebellum on here. Okay. The other thing I want to show you is I kind of dissected this off, but all this membrane here is part of the meninges. I cut it, but this is the tough mother. This is actually the dura mater. The pia mater and arachnoid you really can't appreciate, but it'll be kind of stuck to the brain itself. So I'm not going to really ask you what is this, but you could clearly see the dura mater here. So let's look at the inferior portion. The inferior portion, similar to what I showed you on the brain model, up here, this is going to be your olfactory nerves. This is, so I gotta look here. So this part is going to be the olfactory tract over here too. This is the olfactory bulb where it kind of flares out like this. The nerves, the olfactory nerves, will go down through the cribriform plate into the nasal cavity, and that's going to it'll sense the smell. And it goes through here, and then eventually will go into the cerebrum to interpret the smell. Okay, you could also see down here, this, you could appreciate, hopefully, the X here. Remember, this is rostral, back here is caudal. This here is the X I showed you about earlier. Where it crosses, this is the optic chiasm. Out here, that's going to be distal to the optic chiasm, are going to be the optic nerves, okay, which is cranial nerve 2, which, by the way, olfactory is a cranial nerve 1. And back here, that's proximal to the optic chiasm, these are going to be the optic tracts. All that will make this so-called X. There's tracks that go through here and they kind of cross over. We'll do that in lecture explaining what actually, how that actually works, okay? Okay, so that's pretty much what you need to know about on the outside of the brain, okay? So let's talk about what happens if we do a sagittal cut. So we're going to take the brain and cut it in half, okay? So,